All right, so special senses. The special senses include things like taste and smell and hearing and balance and vision. The reason that we call them the special senses is because they are very specific in how they work and where they work. So you can't see with your elbow, you can't see with your knee, you can't see with your big toe. There's only one organ in your entire body that has the receptors that can respond to light, and that's your eye. So, we're going to talk about taste and smell first. These are both chemoreceptors, basically meaning that they use chemicals to detect something. For the sense of taste, you've got tastants, that are chemicals that dissolve in the saliva on your mouth, or in your mouth, I should say, to get to your taste buds, where you've got your gustation cells that allow you the sense of taste. With smell, it's very similar, except instead of tastants, you've got odorants. Odorants are chemicals in the air that go up your nose and dissolve in the mucus that is along the olfactory epithelium in the top of your nose. Now, those sense organs, the nose and the taste buds, they are the only cells in your body that respond to these chemicals. Once they respond, then they can send that message to basically the relay neurons, the neurons that carry it to your brain. And your brain interprets that information, whether it's a floral smell or a pepperminty smell, or if it's a sweet taste or a sour taste. That does not really happen on your tongue, and it really doesn't happen up your nose. That interpretation always happens in your brain. They are also very closely linked. If you don't believe me, get a cold and have a stuffy nose. If you've got a stuffy nose, it's kind of hard to taste your food, right? So, people that actually have damaged noses, like for some reason, their olfactory sense doesn't work anymore. Remember that olfactory is just a fancy way of saying smell. They usually have a very difficult time eating because nothing that they eat tastes like anything. So it can be an issue if you're lacking this. So let's start off with gustation. Again, gustation is just a very fancy way of saying taste. Okay? So the bumps on your tongue, I'm pretty sure everybody who grew up like I grew up, you'll say that those bumps on your tongue are taste buds. Whoops. They're taste buds. But you're wrong. They're actually not. They're actually papillae. Okay? So papillae are the bumps that you find on your tongue. The taste buds that you're thinking of are actually microscopic, and they're embedded inside of those bumps. So we actually do have 4 different types of papilla on our tongue. Veillate papilla are kind of the most obvious. These are the ones that you can see very, very well, and they occur in an arch at the back of your tongue. If you go to a mirror and you stick out your tongue, you can see these. Usually we have between 8 and 12 along the back of our tongue, and it kind of does give us the landmark for the back of the tongue versus the front of the tongue. If you look, it kind of looks like I've got a culvert here, and then my taste buds are way down here. And in a way, that's exactly what it is, because as the saliva comes down into these little creases, it allows that saliva carrying those chemicals to come into contact with our gustatory cells, our taste cells, so that we can actually taste what it is that we're being exposed to. Now, another type of papillae that we have are folate papillae. Folate papillae are a different shape. You can tell that they're kind of more spiky than they are big and huge like what you see here. These actually are fairly spread out along the sides of your tongue. And again, you can see that we've got those embedded taste buds, those microscopic taste buds here. So these are the most sensitive taste buds that we have, and they are usually, like I said, along the sides of your tongue. So when you taste something and it tastes terrible, one of the first places that you want to scrape is actually the side of your tongue. Now, something else, they decrease with age. So when we're young, if you've ever seen a baby get a lemon or a pickle and that that they do because it's so sour, right? They have more of these extra sensitive taste buds than we do as adults. That's also why our tastes tend to change as we get older. Now, filiform papillae. Filiform papillae actually don't have taste buds at all. But if you look at the shape, it kind of looks like a hook, right? This type of papillae isn't involved in taste. It's actually involved in the manipulation of food. It's more like having a grappling hook to hold on to your food so that when you're trying to put it in between your teeth to grind it, you've got better control over that bolus or that little clump of food in your mouth. And then finally, we've got the fungiform papillae. Fungiform papillae look like the top of a mushroom. That's the reason we call them fungiform papillae. And again, those taste buds are embedded internally. They're microscopic. It's not something that you see with the naked eye. And this is just an electron micrograph showing you the top of the tongue and the filiform papillae versus the fungiform papillae. You can see that the tips of the filiform are very small compared to that mushroom cap of the fungiform. So, taking one of these taste buds and actually blowing it up, you will notice that we have several different cell types inside of this taste bud, okay? One of them are supporting cells. So every single special sense that we have kind of has the same group of cells within it. There's the one that does the job, in this case, the taste cell, and then there are cells that surround it whose job it is to take care of that taste cell. As well, at the base here, we have a basal cell. So think about this for a second. What do you put in your mouth on a daily basis? You may do potato chips, you may do coffee, you may do, tea. All of these things can be fairly dangerous for your taste buds. If you think about coffee, coffee can be very hot and it can actually burn your tongue. Everybody's probably experienced that with either coffee, tea, or hot chocolate, right? As well, let's say I'm eating Doritos. Doritos are very abrasive. They're going to be abrasive up against your tongue, especially when you first put them in before saliva has any time to kind of get in there and make it a little bit softer. So it isn't unheard of for us to lose these taste cells. We have to have kind of a backup plan. We have to have a replacement. So these basal cells that you see are actually the replacements. If I'm drinking coffee and I burn my tongue, for a few days, you kind of don't taste so well anymore, but these basal cells that you see down here will actually grow into new taste cells to replace the ones that have been damaged. So there is kind of a high turnover. So looking at the papillae model, you can see that we've got the velate papillae with those little culverts like we talked about before. We've got the little white dots, which are representative of our taste buds. And you can see that we've got some in the velate papillae kind of toward the top. We've got the fungiform papillae, number 2, over here. We've got the filiform papillae, number 3 over here. We've got the folate papillae, which are kind of over, whoa, let's go back. Over here. The lingual tonsil is in the tongue model, so just give me a minute. At the top, okay, so up here, you can see that we actually have lymph follicles. So the lymphatic follicles are going to be part of our immune response. Think about it. Everything you're putting in your mouth has been outside in the environment, which means that it could have anything on it, which means we should have some kind of defense against that. Now, down here, these pink kind of globby looking things, these are going to be our mucus glands. It's one of the reasons why sometimes our saliva gets real thick, because we're making a different kind of recipe of saliva. The intrinsic tongue muscle is number 12, which is way down here. Okay. Number 13, see that kind of deep crevice right there? That's the crypt. Number 9, these orangey looking things. These are going to be the lingual glands. And number 8, this white that you see down here is going to be the submucosa, okay? Whereas up here, it's going to be the mucosa. Now looking at the tongue itself, there are my velate papillae. Remember what I said about the front and the back of your tongue, right? On the sides is where you've got the folate papillae and the filiform papillae. The lingual tonsil is way the heck back here, okay? The palatine tonsil is kind of in your throat. The epiglottis, this is the thing that folds down over your air tube when you're swallowing so that food doesn't get into your breathing tube, so that you don't choke. Okay. Now, the slides. So, this is a taste bud. And remember those crypts that we saw? Yeah? So that the saliva can get in there. If you look real close here, you'll notice these kind of football shapes. Those are the taste buds. So you've got your papillae, and along the sides here are the taste buds, just like in the hand-drawn pictures. So let me erase this so that the pointers will look nicer. You've got the epithelium of the papillae. Don't forget, epithelium just means covering. You've got the muscle of the tongue. All of this dark, well, I guess I should say lighter, kind of pink is the tongue muscle. And then here, you've got the taste buds. So when you look up close and personal, see these little footballs right here? These are the taste buds that are embedded in the side of the papillae. So looking a little bit closer, you still have the epithelium of the papillae. You still have the muscle of the tongue. You can see that this is smooth muscle. Its tissue type is very distinctive. And then you've got, that's a horrible color. You've got the taste buds on the side here. Like I said, they kind of remind me anyway of footballs. Okay? Taste buds are not what you see. Taste buds are microscopic, but they still exist. Now, with olfaction, your nose is part of this special sense, because this is how we get air up here to the olfactory region where you've got your olfactory epithelium. These nerve fibers go from that epithelium up to the olfactory bulb, which in turn turns into the olfactory tract, which takes that sense of smell up to your brain to get decoded. Remember, I don't smell with my nose, I smell with my brain, but the incoming information comes from right here. So, looking a little closer, there's that olfactory bulb that becomes the olfactory tract to get up to the brain. Here's the cribriform plate in the skull. Remember what I said about you kind of have the same cells. So you've got the olfactory neuron. That's the purple neuron. This is the one that picks up odorants. This is the one that can respond to that chemical. Then you've got these kind of light pink supporting cells. Again, their job, take care of the olfactory neurons. And then you've got the basal cells, these guys down here that are pink kind of triangle looking cells. It's the same concept as what you saw with the taste cells. You have a tendency to damage the surface of your nose sometimes. If it's very, very cold outside, you can kill these cells. If you're not wearing a scarf around your face or a muffler of some kind to warm the air, you can actually do damage. So if by chance I do damage to these cells, I want to have replacements that are just sitting there going, whenever you're ready to go, I'm ready to take your place.